Thank you, everyone, for being here today. As always, I just want to thank everyone in the press for covering the information we're going to give out today. First, I want to give a quick update about the numbers in Boston. The latest numbers are 133 cases of the coronavirus in the city of Boston. There are 646 statewide. We've had 15 people in Boston make recoveries, and what that means is they have 2 negative consecutive coronavirus tests. This weekend, we had our first coronavirus-related death in the city. Our hearts continue to go out to the family of the loved ones, and our thoughts and prayers with the family of all the 5 people that have died in Massachusetts as a result of coronavirus. With each tragic loss, it's a reminder of how dangerous this situation is that we're living in, and we're going to continue to do everything we can as one community to protect each other and prevent further loss of life. I can also right now, unfortunately, confirm there's a second Boston resident that has passed away. This will be reflected in the data shared this afternoon by the state. I want to continue to thank our healthcare workers and first responders for the work they're doing nonstop to slow the spread of this virus and to answer the call when they're asked. The best way we can do this is to show gratitude for those on the front lines is by staying home, because so many other people can't stay home. Physical distancing is the most effective way we have to slow the spread, to keep people healthy and preserve our medical capacity. I can't stress that enough. Physical distancing is something that we need all of the people in Massachusetts to do. The governor talked about it today during his press conference. All elected officials, a lot of people are talking about it, so we're asking everyone to please practice physical social distancing. About the governor's announcements this morning, you heard the governor issued an emergency order requiring all non-essential businesses and organizations to close their physical workspace and the facilities starting tomorrow at noon for 2 weeks until April 7th. The order also limits gathering of 10 people during a state of emergency. That's a reduction from the 25 that had previously been set. The Massachusetts Department of Public Health is issuing a 2-week stay-at-home advisory outlining self-isolation and social distancing protocol. This is not a confinement order, but it's explaining to people that they should stay at home, only leave when you need to. When you go to the grocery store, go to the pharmacy, other essential errands. We also want to remind everyone there's no reason to panic buy or hoard groceries. Our supply chain remains intact, and there's no plans to close stores, and we're in constant contact with all of our grocery stores. Also, Boston water is safe to drink. It's being regularly tested. There is no need also to hoard water bottles, so when people go shopping, the water that you have in your house is safe. Again, at the point of the state announcement is to slow the spread of the virus. There is no overwhelming, so we don't overwhelm our hospitals. So we want to, as much as we can prevent the virus from spreading, we can keep people out of the hospital and keep people safe, something that's really important. And all of this is planned to get our lives back to normal eventually. What does this mean for Boston? People have been asking for a couple hours now. We continue to be in contact with the state and the public health experts who support Boston's residents and are monitoring the situation very closely. We are planning and preparing to support Boston residents through whatever is required. As we move forward, especially in this critical time, we continue to support our most vulnerable residents, our seniors, our families who rely on free breakfast or lunch, our homeless population. Any action taken has to be matched by support by the groups and help people with critical services where they need those critical services. That's why I brought a team of experts who started actually yesterday reviewing our emergency management plans and speaking to our critical departments. Their goal is to update our plans and service to reflect our needs of our residents who have today, prevent any gaps in service that might arise, and coordinate the best use of our resources moving forward. It's a team being led by 4-star General Stanley McChrystal, who is the commander of our National Premium Counterterrorism Force and the Joint Operation Command. For the next 2 months, this specialized team, the McChrystal Group, will focus on support our work and the effectiveness of our response here in Boston. That will include coordination of our agencies, integrating our response plans, ensuring effective and transparent communication of those plans to all of our residents so people in Boston know everything that we're doing. We expect that this work will be done with urgency. Our goal is to share the insight and best practices of the McChrystal Group with cities and towns across the Commonwealth if it's helpful to them. I am not willing to leave anything to chance when it comes to the safety and well-being of our residents. This is uncharted territory, and I'm very grateful for their support. We are actively preparing for the future, but most importantly, we're going to continue to provide services to meet the needs of our residents today. Updates on a few different areas for our students. Our Boston Public Schools are closed. We are working with all 53,000 students to make sure that they're fed and engaged with learning activities. We're delivering Chromebooks, which are laptops and for online learning at home. So far, we've distributed about 15,000. Every day, we're distributing more of them to our young people, as well as free meals at 70 locations across the city. We're going to continue to operate the meal pickup sites and Chromebook deliveries during the statewide stay-at-home advisory. So we're asking families, if you need information, go to boston.gov/coronavirus. For people experiencing homelessness, shelters remain open. We are continuing to put in place measures to protect shelter guests and prevent the spread of the virus. We are erecting facilities for screening, testing, and isolating patients next to Southampton Street Shelter and Pine Street Inn. The first tent opened Saturday afternoon. It has the capacity for 18 individuals who have mild symptoms but are unconfirmed. Last night, Sunday, there were 16 individuals. This allows the individuals previously stuck in ERs to move to safe locations to free up hospital space. To date, nobody has the coronavirus in our homeless population. The second tent is scheduled to open in the next couple of days. It will house those who have been exposed to the virus at capacity of 20 people. The Boston Public Health Commission will offer supports by providing meals, security, trash pickup, and other services as needed. As of today, we have no known coronavirus cases among those experiencing homelessness. I also want to mention that the city is actively hiring candidates for critical positions such as homeless counselors, recovery services, and public health advocates, and public safety officers. Please go to bphc.org for job listings. Our seniors, our 8 Strong Commission is here for you. Staff is reaching out through buildings and service providers, and we're doing phone calls in multiple languages to make sure that our seniors stay up to date on the most pertinent information that they need. I want to make sure that our seniors understand that the stay-at-home advisory means them as well. It reminds us to stay home as much as possible, do not have guests, and try and limit your interaction with people. Phone calls is fine, and FaceTime, for those of you that do it, please do that, but we want to keep you safe. Grocery stores, food pantries, and pharmacies remain open, and many of them have created special hours for our senior population. If you have any questions or you need help, we're asking our seniors to call 311, and we will get you the answers that you're looking for. For our residents looking for help with food access, the Greater Boston Food Bank has 150 food pantries and meal sites open in Boston. They are well stocked. In addition to that, we have 70 meal sites for our Boston Public School students. Times and locations, we're asking you to call 311 or go online to boston.gov so we can get that information out to any residents here in the city of Boston. For people in recovery, the crisis has presented new challenges and a hard time for many people. I also want you to know that resources are available. All of our city recovery services are still open, including our PATS and Access to Care program. Our city's AHO program, harm reduction program, is also open. We have a mobile van operating citywide out there. Our street outreach teams and engagement centers continue to be there for the most vulnerable people. The residential recovery campus in Mattapan is open. We also have online services at boston.gov/recovery, but also we're asking people to please contact 311 if you feel vulnerable or you want to find out about services that are available. Local organizations are doing great work. The Phoenix Group has a gym offering free online fitness classes 2 hours a day, every 2 hours. So folks that are home and in recovery, if you want to do the workout through Phoenix, you go online and connect with them. It's also important to understand that go for walks, if you go for walks, but again, it's about social distancing and physical distancing, so you're able to walk through our parks if you like, but no congregation. We're not encouraging anybody to congregate. Recovery Network have survived hard times throughout history, so making a call or connecting online is important. As I said the other day, those folks that are in recovery that are listening or watching, reach out to somebody that might be vulnerable to touch base with them just to check in. For our small businesses, we've lifted restrictions allowing our small businesses to offer takeout and delivery. We're developing a guidebook on how to set that up. You can contact our 311 office, our Office of Economic Development. We'll get you more information on that. We've created Support Boston Restaurants. It's a directory for residents to know what's open and what businesses to share information on. This is something, if you're in your home and you want to give local businesses an opportunity, you want to see who's delivering and who's offering takeout, go to our website. You'll be able to find that. We have over 280 businesses on our website at boston.gov/coronavirus. I also want to remind both restaurants and residents to continue practicing social distancing while waiting for takeout. We're hearing at different points of the day and different times that people are gathering inside restaurants. When you place an order, if you could stand on the sidewalk and practice social distancing, that is really important for you to continue to do that. As restaurants, I'd like you to do the same thing. Just encourage folks to spread out so that we're not having people on top of each other. I recognize how difficult it can be to change our social practices, but we must. We're in this collectively together to save lives. I also want to let families and residents know that may be experiencing financial hardship during this difficult and unsettling times. There's been a lot of conversation about stimulus packages coming from the federal government and money coming from the state. But it's important for you to reach out to your banks. Our banks want to work with you to help, whether it's reworking the terms of your mortgage or other assistance, but they need to hear directly from you. I was talking to some banks today, and they're putting products out there and some information out there. So don't take it for granted. Reach out to your financial institutions on payments, on your credit cards, and also payments on your mortgage payments to let you know what options they're doing for you right now. A reminder for today, Boston's pause on its non-essential construction starts today, which means that temporary guidelines issued by Boston still stands. Any questions on whether you're considered essential can be answered by visiting boston.gov or contacting the City of Boston Inspection Services Department. All major construction projects minus hospital work that's done inside should not be working today unless it's emergency work. The bottom line. The coronavirus can spread through work sites as quickly as it can spread to offices, and we want to make sure that we keep our residents safe, and we want to keep everyone as safe as possible. We're also working on guidelines that when we can get people back to work, what those guidelines should be and how those guidelines should be followed. Daycare closures start today statewide. We have 379 emergency centers throughout the state. That includes 27 in Boston that remain open for families with no other option. The priority goes to healthcare workers, essential public and human service workers, grocery store employees, public safety, other emergency response personnel. We are monitoring the demand for these emergency services in order to understand if there's any gaps that need to be closed, that we will try and address them. We're also aware of the challenges facing early education providers and their families, so we're going to be working with them as we continue to move forward. The Boston Resiliency Fund, one of the reasons why it was set up was to support child care for first responders and medical personnel. So we're working to make sure that we have the appropriate child care for those folks. City Hall staffing, our plan for modified hours and working from home staffing is in place. City Hall remains open for critical services only. We are keeping the city running. We are going to be street cleaning starting on the 1st of April. We will not be ticketing and towing for street cleaning. Trash and recycle pickup will continue on, and other essential programs will move forward. But we are asking people, rather than come to City Hall, we're asking you to call ahead or go online and get as much service online as possible so that we can prevent as much interaction with the public as possible. For information, we want you to go to boston.gov/coronavirus, or you can call 311. To get regular updates, you can text BOSS-COVID to 99411. That's 99411. We also have Twitter accounts, I have a Twitter account, City Twitter account, and the City of Boston. You can get all your information through there. The information we put out is information that we double check to make sure it's accurate. And please do not pass on rumors. If you don't see it on TV, you don't read about it in one of our newspapers, we're asking you not to pass that information unless you confirm that information. Our press is making sure that all the information they put out is verified, so we want to make sure we get accurate information. The last thing we want to do is set out panic in front of people. I want to thank everyone who stepped up for the Boston Resiliency Fund in an incredible way. So far, we've raised over $17 million from over 1,500 donations. Those donations are going to help people in need. The main objective, just so people know, the main objective of this fund is not to pay bills. The objective of this fund is to make sure we have food access and we pay for food that we need in the city. It's also to provide tech support at home for our at-home learning and to support our child care workers and first responders. So we want to make sure that people understand that. We are still asking construction companies and other folks for unused masks and gloves to donate them to our hospitals and medical centers. We now have a form people can fill out at boston.gov/coronavirus if you have anything. I want to thank our nail salons this weekend. Many of our nail salons in the city of Boston had hundreds and thousands of gloves and masks on the shelf, and they donated them to our first responders community. So we want you to contact boston.gov so we can get it into the right hands and make sure that we're getting the information, getting the materials out to folks that need it. Lastly, I just want to speak to the people of Boston. These are extraordinary, difficult times, but I've seen people come together in the spirit of community. We saw it this weekend when over 1,000 volunteers spread across the city to share important information about the coronavirus and how to stay safe. I want to thank the folks that did that. And more people are staying at home, checking in on their families, their neighbors, and loved ones, making sure that everyone is safe. That is the best thing we can do right now, is to stay home, to stay in and around your home, and to practice social and physical distancing. What we want to do is prevent the spread of the virus. We're seeing our numbers in the last couple of days go up high. We're going to see our numbers increase over the next few days because of testing that has been made available. And what we want to do is stop the spread of the virus. Our seniors and people that are sick are the most vulnerable, and we want to make sure that they don't contract this virus. We see public safety officials, healthcare workers, janitors, public employee workers, shelter workers, and more people doing their job every day out of a sense of duty and compassion. I want to thank everyone for your cooperation, who's showing what it means to be Boston strong. I am so proud to be the mayor of this great city. I'm so proud of the people of Boston and all they do, including the folks that are interviewing me right now. They would, I'm sure, would love to be home with their families, but they're passing the news on. So we want to do our part, and our part is to make sure that we keep everyone safe is by keeping to yourself. With that, I'll open up for questions.
Mayor, speaking with your healthcare experts, are you getting any sense of a rough date or ballpark date on when things might start to return to normal, when they might turn the corner?
No, I don't think we're at that point yet. We've been in constant communication. I think over the course of the next couple of days, we're going to see an increase in numbers because of the increase in tests. We have not heard that yet, and I'm talking to the experts. Would love to see that. I don't think we're going to have it. No one will be able to confidently give us a date that this is the safe date. And I just think all the work we can do right now to prevent the spread of the virus from happening. You know, we're looking around the country and seeing the numbers in New York jump off the page and the numbers in Michigan jump off the page. And I think that hopefully a lot of the action that we took 2 weeks ago by canceling the marathon and canceling the parades and doing it very quickly, hopefully that will have an impact, but we won't know for another week or so.
Mayor, you announced that second death. Can you give us any details, maybe age range?
No, I don't have any of that. All I know is the second death.
What do you think about the governor's order today?
You know, I think, you know, I've been talking to the governor and we've been talking to mayors across the Commonwealth of Massachusetts, and I think that the order really depends on now if we practice it. And I think that it's incumbent upon us as individuals, as citizens of the Commonwealth of Massachusetts to adhere to what the governor came down with today. And I think we can prevent the spread. I mean, this weekend I still heard people gathering at homes, having parties, not parties, but having social gatherings in their home. That shouldn't happen. You know, even 4 or 5 people sitting in an apartment, that shouldn't happen. We need to really stay ahead of this and practice more physical social distancing.
The work of the Crystal Group, how much is that going to cost the city?
No, I don't have the number on that right now, but you know, I'm not concerned about that right now. I'll get you a figure for that. I'm concerned about making sure that these are experts that are trained in what we're doing here and bringing them in here to make sure the work is done. But I will get all that to you. I'm not hiding it. Hold on, let me get Billy and not come in. No, that was asked today. I mean, we're going to, if I have to get on the phone and talk to people, I mean, we don't have any regulations right now to say, you know, we're going to give you a penalty. I mean, I just think right now it's a common sense thing. If you sit at home for 5 minutes and turn the TV on, every single news outlet is talking about the coronavirus. And all you have to do is look to Italy and see the number of deaths happening in Italy. And we want to prevent that from happening here in the United States, in Massachusetts and Boston. So we're asking businesses to do the right thing here.
Governor of New York and Governor Baker talked about rights for tenants, people that are worried about potentially being evicted from their homes.
Yeah.
What's your message to tenants who might be worried about that, and are you asking for landlords to put a hold on it?
Yeah, I think part of what I talked about today with the banking industry is the banking industry is coming up with some products, for example, that over the course of the next few months here, maybe suspend some mortgage payments of people that can't afford to pay it, and put on the back end so that they can suspend the rents from their tenants. And I think that you have to reach out to the bank. Don't just automatically assume that. If you don't reach out to the bank, that's not going to be an option for you. But I would suggest to landlords, your tenants are stressed, and your tenants are going to have a hard time, particularly maybe not this month. You might have had it saved up, but if this goes on beyond the month of April, you're going to have real serious concerns. So I would suggest that the landlords reach out to the banks and pass that down to the tenants.
Mayor, you've got one EMT who's been diagnosed positive. I understand there are a number of EMTs who are in quarantine. I've talked to police unofficially who are having trouble getting hand sanitizer and other protective equipment. I know this isn't your fault, but
Yeah.
What are you doing to keep, what can be done to keep first responders as safe as possible?
Yeah, we do have 4 EMTs that are in quarantine right now. They have not tested positive for coronavirus. We do have 1 EMT that did. When it comes to hand sanitizer, we had from what I understand, and I haven't heard that, there was some issues last week, but over the weekend that was all corrected. So we're going to make sure that they have the hand sanitizer, and I think police are taking precautions, such as the way they're doing roll calls and things like that, not bringing a lot of people into the station. So they're also trying to practice as best they can social distancing from each other, and then they have to do their job inevitably. So a lot of that has been worked on. So I'll follow up to make sure that they have enough of hand sanitizer and the equipment they need.
Any indication of the number of police and firefighters that are in quarantine? Are there any?
No, to my knowledge, we only have 1 police officer that tested positive. We have 1 EMT that tested positive and 4 in quarantine. 4 EMTs in quarantine. No other, not to my knowledge.
Mayor, you've really been out in front of this, as has the governor. And you've addressed people's fears, but I think with the governor now announcing the stay at home that will start tomorrow, I think maybe it's ramping up some of the fears of the public. Kind of, what is your?
Yeah, I mean, and I tried to address this last week when I talked to the City of Boston residents, is that these are difficult decisions to make, and they're being made for an abundance of safety and precaution. And I think that if we can get everyone to adhere to them and listen, we'll get on the other side of this faster. And I think that the social distancing definition. We've kind of transitioned to physical distancing, and so because it is important that people stay connected to each other, and a lot of us, the world has stayed connected through texting and FaceTiming, things like that. Now it's probably really important for us to reach out to one another and be there for each other. And I think that what the governor wants to do, and what we want to do, and other leaders in the Commonwealth, other mayors that I've talked to on the phone all day today, and town managers, is to do our best to kind of stop this in its tracks. And the way to do it is by constant communication, by getting information out. And the best way to do it, honestly, is by social distancing and physical distancing. And go for a walk, but no gatherings. I think that we need to stop the spread of this virus. Any other questions?
Are you guys still looking for volunteers, like upcoming weekends?
Yeah, none. As of right now, no. We are looking at one of the things the McChrystal Group is looking at. If we have to go to do home deliveries of food and things like that, they're coming up with a plan. We did the drop last weekend to the entire city of Boston. I'm not saying we won't do that again. That potentially we will, but as of right now, no. We're really asking people to kind of stay in their home and stay in and around their home. Looking at all of our plans to make sure that we have, when it comes to our homeless plan, making sure that we're taking everything into account, making sure that when we think about how we're going to carry out different operations if need be, how we're going to get people fed, how we're going to do home delivery and things like that. Every aspect of government. We did, nobody has on the shelf, or not many people has on the shelf, in the event of a pandemic, what do you do? City of Boston will have one now. Ironically, Water and Sewer had one, a plan for it, and they were able to put the protocol in place. We have plans for different types of action, and our public safety have plans for different types of action, but I don't think anyone's ever experienced that a complete, basically, shutdown of society in the course of 2 weeks has ever happened, that, to my knowledge, at least in the 21st century. So these are interesting times, and I think we will get through them. And the McChrystal Group is going to help us make sure that when we're done with this, that we think of things we might not think about, that they're thinking for us. All right. Thanks, everybody.